Geriatric medicine is a specialty that focuses on the care of elderly people. Oman is a very new young country and plan to establish geriatric care clinic in coming years. My name is Dr. Huda Al Badi, resident in family medicine under the Oman Medical Specialty Board. I came to Canada to study the perspective of setting up a primary care geriatric clinic because there is an urgent need for a geriatric care in Oman. The Ministry of Health in Oman is working on the concept of providing a caregivers or a trained sitters to take care of elderly population in Oman. Oman should now be concerned with the welfare of elderly even while their population structure is largely youthful. However, the life expectancy in Oman has increased dramatically in the little more than 4 decades. Our aim from starting this clinic is to focus on the health care of elderly people by preventing and treating diseases and to work toward less disabilities. First of all, we need to know what's the situation in Oman these days. According to the statistic, 5.2% people in Oman are above 60 years of age. This is expected to reach up to 10% by 2025. In recent years, more and more families becoming nuclear from joint. Common to see both husband and wife working. Care of the elderly left to the housemaids and houseboys, often untrained and high turnover. Sometimes hospitals are used to provide long-term care unnecessarily. Geriatric care has 2 steps. The first step is the assessment and the second step is management. In this presentation, we will discuss the first step, which is the assessment, and the management part will be discussed in another time. We will depend for the assessment on comprehensive geriatric assessment tools, and our source is mainly from American Family Physician and up to date. What is the comprehensive geriatric assessment? A multi-dimensional and multidisciplinary assessment of functional ability, physical health, cognition and mental health, socio-environmental issues. Let us talk about them one by one. So let us start with functional ability. It's referred to a person's ability to perform tasks that require for living. It will begin with the review of 2 key divisions of the functional activity of daily living and instrumental activity of daily living. Activities of daily living is defined by self-care activities that a person performs daily. For example, eating, dressing, bathing, transferring between the bed and a chair, using the toilet, controlling bladder and bowel functions. And the instrumental activities of daily living defined by activities that are need to live independently, doing like housework, preparing meals, taking medication properly, and managing finance and using a telephone. For the second part, physical assessment, we need to have medical history for past and current medical problems, family and social history, demographic data, review of systems, nutritional assessment, and screening. And this is sample for the physical examination. For the cognition and mental health assessment, we will screen for depression by Hamilton Depression Scale and Geriatric Depression Scale. These are easiest to use and most widely accepted. If a positive screening test resulted for depression, that requires further evaluation. The second thing, we need to approach early diagnosis of dementia by use a mini cognitive assessment instrument. It's a preferred test for the family physician because it is speed, convenience and accuracy, as well as the fact that it does not require fluency in English. For the socio-environmental assessment, approximately 70% of elderly live with their spouses and extended family, and 30% live alone, which is still a good number. So we need to assess the social interaction network, available support resources, special needs, and environmental safety. For the assessment of caregivers, we need to assess the level of perceived burden by the caregivers by physical, social, and psychological assessment. And also we need to assess the presence of affective disorder such as depression and anxiety. This is a sample for a caregiver questionnaire. It can help us to assess the caregivers and overview evaluation. So let us talk now about the second part of this presentation about the geriatric clinic in Oman pilot project that will be done in Al Ansab Health Center. This clinic will be led by a family physician and team members. The core assessment team include a physician, a nurse, a social worker, physical and occupational therapist, a nutritionist, and pharmacist. We can have a backup with a peripheral assessment team such as a psychiatrist, psychologist, dentist, audiologist, podiatrist, and opticians. For geriatric assessment tools and survey instrument, we need to evaluate the activity of daily living, hearing, fecal and urinary continence, balance, and cognition. This is an example of one tool that can help us to run this clinic, which is mini cognitive assessment instrument. This is another tool that we can use to evaluate the activity of daily living. In conclusion, with the changing social structure in the country, where more and more joint families are become nuclear, there is a strong need for taking care of a physical, social, and psychological need for our elderly.